Well, it is Prostate Cancer Awareness Month, and Dr. Austin Lutz from the Urology Centers of Alabama joined me at this raising awareness on the health issue. Tell us about this. You come in, you get the exam, you get checked out. How often do you need to be checked, and at what age?
So, great questions. Certainly, if you have risk factors for prostate cancer, such as African American, if you have a family history, we want you to get prostate cancer screening at around the age of 40. If you don't have those risk factors, you could still get a baseline PSA around that time, a blood test.
Right.
Just to know where you are, and then if there's no significant risk factors, at least at the age of 50. Some of the newer guidelines, are 45 to 55, depending on which society you're sort of looking at. So.
Now, the PSA blood test, so what all they show? They just say like higher white cell counts, or what does it do?
It's actually, PSA is a serum protease, so it actually helps hydrolyze some of your semen. It doesn't have a big role otherwise, but prostate cells produce it, and then prostate cancer cells will produce it highly.
Okay.
So it's actually a specialized test. And then we try to actually screen smarter. So a lot of what we're doing now is additional tests that may be even more selective than PSA to then decide if you need to go on to get a biopsy.
And then you also, they check for any kind of lumps and things like that, just
Absolutely.
like they do for women with breast cancer, right?
Absolutely, yeah. So we're checking for lumps. We're also checking for the size of the prostate. That may be a reason that you have an elevated PSA. We're checking to see if you have tenderness or symptoms of something called prostatitis, which is actually an infection of the prostate that can cause the PSA to go up as well.
So other symptoms, if you're having problem urinating or something like that, or just a pain down there? Or...
Typically, you won't have symptoms.
Okay.
So we actually diagnose most men with the PSA screening. Prior to PSA screening, men had very advanced prostate cancer. They did have difficulty voiding, blood in the urine, bone pain from metastatic disease. So PSA has kind of revolutionized the way that we find men with prostate cancer sooner. A lot of those symptoms that you're talking about, difficulty urinating, so on and so forth, does affect a lot of men. That's something called benign, non-cancerous enlargement of the prostate. And then we have lots of things that we treat men for with that.
Is there a website or anything we can go to find out more information?
UrologyCentersAlabama.com.
Okay. Well, Doctor, thank you very much for joining us this
afternoon.
Thanks for having us. Okay. We're going to take a break. We'll be right back.